So this is our patient. You know, I left someone out. You know, again, I have to thank my team here, which is Dr. Waltuck and Moya. But I'd like to also now give a round of applause to our patient. You know, this is Tidra. Okay. Right. Tidra's a little nervous, right? But she was, if I say kind enough, that's like not even like close to what it is. You know, to come up here and sit here and be that patient is not a simple thing. So Tidra's missing several teeth, but we're going to treat just one. Okay, just one of her teeth. Okay, here's what her teeth look like. The teeth are apparently sound. You see, she's missing tooth number 5 in the maxilla. She's missing multiple mandibular teeth. Okay, but what we're going to do is we're going to treat this tooth. And here's the reason we're going to treat this tooth. Anybody know why? Because it's going to be easy for you to see, right? When we retract Tidra's lips and it's right in the maxilla, almost in the anterior, right? It's easy to go ahead and see. And I don't need to do what I'm going to do now and repeat it 5 times, right? I want the opportunity to talk about a lot of different things. And so we're going to go ahead and pick one simple area to go ahead and treat, and we're going to follow through the whole process, and then we'll go ahead and talk about more involved complex cases and how that system and how those protocols, you know, are used for all of those areas. So there it is, okay? Area, tooth number 5, right? A lot of bone, right? A lot of bone. Someone say, well, why would I even need a guide to go ahead and do that, right? You know, and so hopefully when we finish, you'll have a better understanding in terms of doing that. Okay, so we want to get to surgery, right? The patient comes in. The patient's eager to go ahead and have their implant placed, or maybe not their implant, a tooth made, right? So what do we need to do? Step number 1 is we need to collect the data, right? What's the data? We said it's the CT scan, right? And diagnostic models. So how do we do that, right? CT scan we take with cone beam. Today there are different ways of going in and do it. You know, some people order a truck and comes to their office. But if you're doing any amount of treatment, right, you're going to have a cone beam CT scanner, you know, inside your office. And then there's intraoral surface scanning, right? Intraoral surface scanning to go ahead and collect the model data for the patient. But if you don't have an intraoral scanner and you want to start the process, you can do it without an intraoral scanner. You can take regular conventional models, and the laboratory will go ahead and put the models into a laboratory scanner and scan for you. So let's first talk about cone beam CT scanning. So this is my office, and here's my CT scanner that I have. This is from LED, right? Everything that I'm showing you, or the sponsors that we have, these are things that I actually use in everyday practice, okay? Or I wouldn't talk about them. Okay, so this is the Samsung CT scanner, right? It fits. It kind of looks like a Panorex machine. It'll take conventional pans. My machine doesn't take SEPs because I haven't set it up for it. But we use it for panoramic X-rays, and we use it for mostly for cone beam CT. And then you see Moya is kind of getting that set up. Okay, and there we have one of my other assistants. That's actually Tia, not Tidra, in there, just to show you kind of how it operates. The patient's positioned in the machine, just like you're positioning the patient for a Panorex, with some slight modifications. But that's how you do it. There are positioning lights, right? And then the head of the machine rotates around the patient's head. Now, if you look at the head of this machine and you see all those colors, okay? You see the blue, the green, the yellow, the orange, okay? That's the light on the head of the machine. And it tells you at what point in operation the machine is. If the machine's on standby, if there's radiation being emitted from the machine, right? So when that cone is spinning around the patient's head, right, you know if it's safe to walk by in the hallway or not. Okay, because you don't necessarily have to stop and wait for the entire spinning to finish if there's no radiation being, you know, emitted. So this is what it looks like. I'm going to go ahead here and show you. So I want to show you what it looks like when the radiation is emitted. Let me get that off. Okay, there we go. Okay, so you see the light's green now. Okay, the light's green. And now it turned yellow. When it's yellow, radiation's being emitted. Okay, and you'll see the scan time is about 14 seconds. So it's very, very rapid, very low dose radiation, very easy machine and predictable machine to go ahead and use, kind of a workhorse. So that's the whole scan. That's the whole length of time it takes. Okay, and now it's back to blue. It means the machine's on standby. These are the images that are initially produced, right? It produces what's called DICOM data. That's a standard format that all the cone beam CT machines that you see and all the CT, medical grade CT machines, you know, you see produce that form of data called DICOM. Now, after the DICOM data is made, and again, this is from LED, right? reformatting software reformats it, and this is what we're normally used to looking at. So if you're doing any implant treatment, these are the kinds of pictures you go ahead and see. But it comes from the DICOM data. So if we take a look at the cross-sectional images, those are the images at the bottom, right? We'll see the volume of bone that Tidra has. Tidra has a lot of bone, right? I picked somebody that not only would get up here on the stage, right, but I didn't want to make an overly complex procedure. So that's number one. Now, let's talk about how do we get our models, because there are two essential pieces of data. Again, our models, number one, and number two, right? Number two, the CT data. So the CT data, right, that took 14 seconds to capture the data, and it took maybe 30 seconds to a minute for Moya to go ahead and set Tidra up inside the machine.